So clonal hematopoiesis is a phenomenon that was described about 10 years ago, and it's a case where basically there are somatic mutations that we believe occur in hematopoietic stem cells that leads to their expansion, and then you can actually detect it in the peripheral blood using next-generation sequencing. And there's been a lot of work over the last 10 years showing that patients that have clonal hematopoiesis, one, it's associated with aging, and two, that when you have these mutations in your blood, you have sort of a number of adverse outcomes. So patients have decreased overall survival when they have clonal hematopoiesis, and that's driven by increase in a number of disorders. So they have an increased risk of malignancies, hematologic malignancies like MDS and AML, as well as some lymphomas. And then they have increased risk for inflammatory disorders, so cardiovascular disease, COPD, gout, heart failure, a number of other conditions that probably impact their mortality as well. And then more recently, we've been looking at the relationship between having clonal hematopoiesis and having another hematologic malignancy like multiple myeloma, and trying to understand for our patients that have multiple myeloma, if they also have clonal hematopoiesis, how does that affect the outcomes of their myeloma, both their myeloma therapy and then just other outcomes in general. And at least in initial studies, it looks like patients that have clonal hematopoiesis and multiple myeloma do worse overall. The reasons for that are unclear, and there's ongoing research trying to sort that out. But it is something that we're detecting more and more frequently as we use next-generation sequencing assays in our standard clinical care. And so I think it's a question that's going to come up more and more as we sort of find this incidentally. And so hopefully over the next couple of years, we'll have more information and guidance on exactly what to do. I think right now, we shouldn't change management based upon the presence of clonal hematopoiesis. I think the data are too immature for that. I think you still need to treat the myeloma the way you would normally treat multiple myeloma. But in the future, that may change as we get more data. So it's an exciting area of ongoing research.